Hello everyone. This video tells us a story of a girl named Mia, and here it begins.
Few months back, one of my aunt returned from China on New Year to celebrate it with all of us. We were excited to meet her. After her return to India, she threw a party to everyone and we had lots of fun. We had a great time. She came to India to stay for 2 months due to the vacations. After a few days, when my aunt left, my sister developed a few symptoms like common cold and flu. Until then, we had become familiar about the COVID-19 alert going on in the nation, which actually had created a lot of panic in China and Italy. According to WHO, on 13th January 2020, officials confirmed a case of COVID-19 in Thailand, the first recorded case outside China. In fact, on 31st December 2019, Wuhan Municipal Health Commission China reported a cluster of cases of pneumonia in Wuhan. Therefore, a novel coronavirus was eventually identified.
Later, my sister's condition got more serious, but there was something which was more disturbing. My aunt, along with few members of the family, now started developing similar symptoms which were weird yet horrifying. Then we went to the hospital to get my sister's checkup done. They checked and denied it to be a normal flu. They were not certain about the diagnosis. She was first given few antibiotics for a week, but still she did not recover. So the doctors advised us to visit any other hospital in the town. In the other hospital, doctors made us aware about the signs and symptoms she had and also made aware of other symptoms what usually people affected with corona show. The symptoms of COVID-19 are basically classified into 3 types: most common symptoms, less common symptoms, and serious symptoms. Fever, dry cough, tiredness, these come under most common symptoms. Aches and body pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, rashes on skin, these come under less common symptoms. Difficulty in breathing, chest pain or pressure, loss of speech or movement for few seconds, these come under serious symptoms.
The doctor advised other members of our family that people with mild symptoms or who are otherwise healthy should manage their symptoms at home. On an average, it takes about 5 to 6 days to show up the symptoms. However, it can always take up to 14 days, which is known as the incubation period, to show up the symptoms. Then they asked us about the travel history of the patient, but there was no such travel history. Then the doctor told us about how the virus got transmitted. They told us that the transmission of the novel coronavirus could be from person to person through the droplet infection. In droplet infection, small infectious droplets travels from either nose or mouth of the infected person to the healthy person. These droplets land on objects and surfaces and mark the source of new infection which infects a healthy person. This is known as the symptomatic transmission, whereas in asymptomatic transmission, an asymptomatic lab-confirmed case of coronavirus who doesn't show any symptom against it is infected with it, and it unknowingly spreads the virus to the healthy persons. Then my family members asked whether the virus spreads through food. The doctor confirmed. Coronavirus appears to be stable at low and freezing temperature for a certain period. Hence, good food hygiene and safety practices can prevent its transmission through food.
The doctors told us that for confirmation, they need to perform some tests. The tests will include first the molecular test, that is RT-PCR test, in which a swab is collected from the nasopharyngeal or oropharyngeal route to diagnose the SARS-CoV-2 infection. The second test will be antibody test, which is done to detect the antibodies of the SARS-CoV-2. This tells whether she previously got exposed to the virus or not. In this, the blood sample is drawn from the patient and tested. To test people in large number, COVID-19 testing kits are being manufactured due to less time and high incubation period. It's called MyLab PathoDetect COVID-19 Qualitative PCR Kit. It screens and detects the infection within 2.5 hours. The current lab tests take around 4 to 7 hours for the results to come out.
Unfortunately, the indications which were correct showed that she was corona infected. Now, the problem was what treatment must be given to her or the patients like her, as doctors around the globe were struggling for the same. Since there were no treatments approved specifically for COVID-19, it mainly focused on managing the symptoms developed. Antiviral and retroviral medications were given, breathing support was provided, such as mechanical ventilators, steroids which reduce the lung swelling, blood plasma transfusions. These were few of the sole therapies which were used around the world. COVID-19 is affecting nearly 213 countries and territories around the world, and new cases are being reported every day since the previous ones. And the Google updates showed that new cases have been reported every 20 minutes. About 80% of them recover from this disease without any serious complications. However, 1 out of the 6 people get infected by this and become seriously ill and report symptoms like painful breathing, infections which can cause serious pneumonia-like complications. Another problem was that to protect the members of the family from the spread of infection, so the whole of her family was put under quarantine. Some guidelines were given by the doctor to prevent the spread: washing her hands frequently with soap for 20 seconds, or to use alcohol-based sanitizers, to use the handkerchiefs while coughing or sneezing, and if not available, using the elbow, avoiding contact with the others, avoiding the ceremonies and gatherings, avoiding non-essential travels. A special care should be provided to the adults of age 65 or above, and also to the children, and to the ones who have previous heart and lung illnesses. To switch to the more proteinous diet to reduce the carbs, increasing vitamins, and to improve the immunity. To introduce Ayurveda-based homemade therapies to boost our immunity, as the person with good immunity can survive this pandemic. The doctors told us to take utmost precautionary measures as to how the whole world knows, because prevention is better than cure. A big salute to the COVID warriors who are struggling day and night for the country. So, stay home, stay safe.